I think the message is that that allied health professionals end up in a hugely diverse range of jobs, and you don't have to be someone at the chief executive of the professional body to say that there are a huge range of consultant, practitioner, management roles, right up to chief executive. We've got radiographers that are chief executives of NHS trusts, and professors in education and research around the country and around the world as well. The Health and Care Professions Council has a sort of basic level code of conduct around which it will regulate the professionals. None of the professional bodies in allied health are regulators as well anymore, except for a very small regulatory function in the Chartered Society of Physiotherapy, which goes around their chartered status. But they don't hold the primary regulatory function. That sits with the Health and Care Professions Council. But what we do is set the scope of practice. And as I've indicated, that's always expanding. And it's very important, I think, for people that come into these professions to understand that the scope is not static. There is constant change. In a profession like radiography, it's very much driven by technology as new techniques come along, but it's also driven by health economics. It doesn't take a genius to realise that consultant practice has actually been driven by the relative poverty of funding in the NHS. And I know that sounds like a hollow thing to say when we're told the NHS is protected, but in terms of the funding streams, whether that comes from private insurance or from government around the world, the NHS is not particularly well resourced. But that's driven a lot of opportunity for better, efficient care, and in terms of our professions, a great deal of advancement and growth of the scope of practice. Multidisciplinary working, as I've already hinted, is very much part of every allied health professional's day. You're always working with other health disciplines. I'll give you a quick example. If you're a paramedic, and you arrive at a scene and you think that someone's had a stroke, then it's very common for that paramedic to refer directly to the radiographer, who they will need to see as soon as they get to hospital. Because if you don't get a CT scan of that person quick enough to diagnose whether they're bleeding, because if they're not bleeding they can be cured, you need that to move as fast as possible. So the best case is that the paramedic will assess the patient, refer them direct to a radiographer who will do the scan. They won't go through the accident department, they'll go straight into the scanner. The radiographer will probably be able to diagnose whether there's any bleeding in the scan and refer on to the doctor who has the anticoagulant to cure the patient. That's multidisciplinary working where it really makes a massive difference. And you'll have seen all of the publicity around FAST to try and get people to realise when the stroke is happening so that there is no time wasted in getting the cure. And all allied health professionals are working in those teams and making multidisciplinary working work. As I've hinted, it's very efficient to work in this way, particularly at advanced and consultant practice level for the AHPs, because we're cheaper than doctors. That's a very sort of basic level thing. But it's also efficient, as I've just pointed out, in terms of time and better care. But there are many people now looking at healthcare professions who've already got a degree because of the employment prospects, because they're a little bit more mature and have had a chance to make sort of clearer choices about their future. So second degrees are very popular. We see, for the same reason, we see quite a lot of mature applicants coming in. And I've stuck master's level entry on there for a second time because 3 of the allied health professionals are actually master's level degree courses, and those are the arts, drama and music therapies. So that entry into that would be people who've basically got a first degree in those areas. But I think it's important that you understand that because if one of your students got a sort of musical bent, for example, but doesn't really see a future in performing, then it still might be worthwhile for them to do that music degree with a view to moving on to music therapy in the long run. Why would they not do that? So training as an AHP, why should you be encouraging people to get involved in allied health professions? Well, there are still relatively good prospects of employment. Woohoo! That's a bonus. In radiography, everyone who qualifies in radiography gets a job because we're still a shortage profession. Sometimes you'll hear horror stories about 5,000 more physios trained than we actually need. That's down to the kooky NHS workforce planning procedures, which frequently get it wrong, and too many commissions are published. It does stabilise out. Even those 5,000 physios that weren't employed a couple of years ago have all got jobs now. The prospects are reasonably good. Another big bonus is you can get your tuition fees paid. There are still bursaries for healthcare professions. That's got to be a bonus these days. It means you come out with only 20 or 30,000 pounds of debt rather than 90 at the end of your. So that's got to be relatively good, I suppose. You were all furiously taking notes, so you've written down all the different professional names. But it's a whole lot easier to go to the Allied Health Professions Federation website, because on there is direct links to each of the professional bodies involved in allied health, and that will take you on to find out more information. Thank you very much.